Alright, this is a video that describes how we do the brush therapy. And I tell the patients that, do you know what this is? And they say, yeah, it's a toilet brush. And I says, to the uneducated, this looks like a simple toilet brush. But to our patients, we know that this is a neurosensory stimulator. Okay? So I take the brush and I hit him in the arm just like this. I say, ready? 1, 2, 3, 4, 5, 6, 7, 8, 9. They go, ow. And I said, that, now you felt that? Then I go down to their leg and I go 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18. And they said, ow. And I said, oh, so now you realize that your arm, you felt that ouch in 9 taps. In your leg, you didn't feel that tap until 18. So the nerves are healthier, and now it's time to stimulate them. So what we're going to do is we're going to repaint the picture of your foot, toes, calves, and leg to your brain. We're going to reestablish that connection. Now that the nerves are healthy, we can reestablish that. What's going to happen to these patients is they're going to do it wrong, and they're going to do it wrong, and they're going to do it wrong. So let me teach the doctors how to do it right. What you want to do is you have to repaint the pain pathways into the brain with this type of stimulation. It's very good. I mean, it's being used in many therapies now. I started doing this 10 years ago. So the way to do it is you have to beat every inch of your skin until it hurts. So if they do it like this, it's wrong. If they do it like this, or they just rub it, it's wrong. They have to start at the thigh and beat it till it hurts, and then move just a little bit. It's like mowing the lawn. You have to not miss any areas. Ow, 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 ow. They start up in the upper area first. They always go to their feet first. They always start right at their toes. And if they are still painful at the re-exam, when you re-examine them and their toes and feet are still painful, you have to tell them very specifically to avoid doing the feet, because it's just going to hurt them. So they have to start at the thigh, work the whole leg all the way down into the toes. Do that in the morning, because if they do it at night, it's going to be too stimulatory for some of the patients that are hypersensitive, especially the restless leg people. They can't do this much. So start at the thigh, beat the area until it hurts. They can go to the side if it's too much information, okay? And they just keep beating and beating and beating. If they are sensitive in their feet, when you do your re-exam, you can tell them, look, just tap your toes in the beginning to see how it feels, and then do the whole leg, and come back. When you do the toes, it'll be less. This therapy is very analgesic. It stimulates the A delta fibers up to your brain, and then in the gray matter of your medulla, you have descending pathways, they're serotonin-based pathways, that actually inhibit pain. So this is very analgesic. It makes the pain go away. You can use it on every area of your body. So bringing back the stimulation, meaning if you're numb, and then you want to bring that numbness back, it's different. You have to, it's not hard to stimulate a nerve once it's had the therapy. Once the nerves are healthy enough, in the thigh, in the calf, in the foot, in the toes, it's very easy with the brush therapy to bring that sensation back to normal. Of course, I go over this in great detail at the Primo conferences, but this is how you do the brush therapy. Both legs in the morning after their shower, every area. They can't miss a zone, or they'll be putting a hole in their brain basically, because that area will not be stimulated. And that's how you do it. Brush therapy. Great question. Let's get them better.